There's a whole range of reasons why, as a community, we need to be more aware, accepting and informed about these conditions. We need to be aware of the warning signs, what to look out for, so that we can identify these conditions early and get help early.
I don't believe perinatal illness is fully understood.
Before we had kids, I hadn't really heard of perinatal illness. In reality, I didn't even know what it was. I'd heard of depression and mental illness just briefly, but I think that, you know, for most people, before you have something like that happen to you, you don't really know what it involves.
My postnatal depression really started as post-traumatic stress from the birth, I think was definitely a factor, but also anxiety around trying to solve this problem of my baby not sleeping well, not feeding well, and as to what would have been a good enough standard of sleep and feeding, I don't really know, but at the time I just knew that it wasn't good enough and that I was extremely sleep deprived and had to solve this problem. So at first it was very much focused on the anxiety and worry of trying to solve that situation. But as the months went on, it progressed into more sadness and depressive type things as well.
I had it in my head that to have postnatal depression, you had it to want to hurt your baby. And so even as educated as I was, I still had that idea that you had to want to harm your baby in order to have postnatal depression. But that's not true at all.
I thought that it was just me failing to do my job as a parent. I saw the failure of Finn to sleep as my, just me not doing my job right. I didn't see it as depression. I always thought that there was something more that I could do to fix it. So I would keep trying. I would read more. I would look into different techniques to use with the sleeping and the feeding, and that was just my way of tackling it, I guess. And it didn't cross my mind that I had depression.
My experience with postnatal depression, I was very lucky. I got excellent care and excellent help very quickly. But a lot of these women don't get care for a very long time.
Perinatal mental illness is the umbrella term that's often used to describe the full range of mental health problems that can occur from the period from conception right through the pregnancy, through birth, and then in that first 12 months of having a baby. So at one end of the spectrum, we have very severe conditions. Things like postpartum psychosis, bipolar disorder. These are severe mental illnesses that require treatment and management right through pregnancy and in the postnatal period as well. At the more common end of the spectrum, we have other conditions like depression and anxiety, which affect a large number of people. And in fact, quite often we don't realise how many people are affected. We often talk about postnatal depression, and it's very commonly talked about postnatal depression. And that affects around 1 in 7 women in Australia. But a lot of people don't realise that women also experience depression in pregnancy. And in fact, 1 in 10 women will actually be depressed during their pregnancy.
I think that my husband and my parents were aware that something was not right. I don't know if friends beyond that would have known, because I did a very good job of hiding it, I think. I wouldn't go out into the world to socialise with people unless I, had that mask firmly in place. If I wasn't doing well, I would just stay in the house. I did spend a lot of time feeling quite trapped in the house. But I think that those who were closest to me did know that something was not right. They just weren't really sure what to do about it or what label to put on it.
I think it was harder than I originally admitted, and today it still does carry over in small aspects into my life. I really have to make a conscious effort to manage those anxieties about failure and about being a good parent. And I think everybody has those anxieties about being a good parent.
I started to have some really horrible, intrusive thoughts. I had thoughts of harming the baby. I had thoughts of harming myself. And to me, at the time, it was part punishment and part just making things right with the world. That's what needed to happen. That it was all my fault that we were in this situation. And then also, yeah, as I was rocking and carrying Penny and trying to get her to sleep, I would have these constant thoughts of just, you know, throwing her or, you know, hurting her somehow as I was carrying her. And that was extremely distressing because, of course, I didn't want to hurt my baby. I did love my baby, and I would, you know, would do anything to protect her. But at the same time, this thought kept coming into my head, you know, what if you just threw her across the room?
You know, I love my son, but sometimes I thought maybe someone else should take over this job. I thought maybe I wasn't good enough to be his mum. Sometimes I would yell at him. I would slam my hand down on the bed next to him and just say, "Go to sleep," or just "Shut up." And, you know, then when I would say things like that to him, to my son, you know, my infant son, I would think, you know, you don't deserve to be a mother. You don't deserve this beautiful child in your life.
I do remember one time being in the car with the baby, reversing out of a parking space into a busy road, and thinking, as you do, you know, you look back and you think, oh, better be careful that nothing's coming, and then just thinking, why?
Just progressively just felt more and more out of control, just this intense anxiety, this feeling of not being able to cope, not knowing how to tick all the boxes that I previously ticked, and sort of this swirling feeling in my head of just not even knowing how to get up and where to start. And waking up to feed her at 3 in the morning and going out onto the deck with her and thinking, this might be easier just for us both to jump off. And just that thought was enough to make me think. I thought it, and I remember getting goosebumps, and I remember holding on tightly because I felt exceptionally, huge love towards her, and I remember thinking, well, I can't possibly do that to her. I felt very upset that I'd allowed myself to become like that, but in reality, it's an illness. You haven't allowed yourself, it's just a chemical reaction and it's what happens.
Sometimes I thought, well, I should just pack my bags and leave and let Sean take over. You know, he seemed to be coping all right. He was making her meals, he was doing the washing, he was putting Finn to bed. He could cope on his own without me. But I just didn't want to leave them.
It's a tough role being a mum because, you know, you've got to be there for the feeds and settling to sleep and generally just being that other person for the baby. And then the baby develops a sense of themselves as being of value. Now that's where we develop a sense of the self. It's the basis for our emotional development, our cognitive development, our interpersonal development, and in fact, we assess other relationships on the basis of our earliest relationships. And the most important one is a secure attachment with mum and dad.
The biggest thing I've learned is that perinatal mental illness is completely non-discriminatory. You can't.
As much as you know, you're never ready for it.
Look, anyone can get it. It's what you get when you struggle too much after having a baby. It's not something that's a purely female, a condition.
When I found out that my husband had postnatal depression, it was really a shock. When I really thought about it, he was just as anxious, just as sad, just as angry as I was.
I think initially I was in denial. I knew that things were not going well with my family, and I'd put my own needs secondary, and just thrown all my efforts on the family. And I think part of that was an excuse not to, admit to myself that things were not going well in my own mind. My own journey of self-discovery with, realising that, A, it was possible for males to have postnatal depression. That was quite a surprise for me. And B, that I was not just at risk, I had quite a good dose of it. My next response was even bigger surprise. I was like, I'm a dude. Or a guy, how can a guy have postnatal depression? And that led on to sort of her then, a bit of education about, look, anyone can get it. It's what you get when you struggle too much after having a baby. It's not something that's a purely female, condition. And I think to plunge on from that point, that was a bit of a turning point. I think the lowest I felt was probably just prior to then, when I felt there was no help, no hope. I felt very alone, I felt very isolated. And as much as I felt a bit shocked to receive this kind of, someone saying, oh, you're postnatally depressed. Also with that came a bit of, I guess, a realisation that there was something that could be addressed, and from here I probably could get help, and there was hope.
The most important thing, of course, is to get help early. And we know that currently often people wait too late and don't seek help until they reach that point that they can't cope any longer. And as a result, we've missed an opportunity to really get in there, identify these conditions early, and give relief to the woman and her family and provide safe and effective treatments.
Probably first call your GP and see if he can refer you to somebody or suggest the medication. But the main thing is to go and talk to somebody about, hey, I'm just not feeling comfortable about what's going on for me at the moment.
And that's the problem, like you say, it's so unique. Like what works for us and what Dane sees in me and what I need from Dane could be totally different with someone else. And, we're getting through it. It's still tough, but we're getting through it.
We ended up at a place called the Ellen Barron Family Centre, which is, you go and stay there for a week, and child health nurses help you out with sleeping and feeding issues. And that was absolutely fantastic to get that support. And they were the ones who identified that I was not tracking so well. And I remember at the end of our week-long stay, they said to me, that we think Penny's doing fine. You and Ben have got some new techniques, to help get her to sleep without you having to hold her so much. And, she's going to be fine, but you are not okay, and you really need to get some help, and we want to help you get that. They referred me to a beautiful psychiatrist who really saved me, helped me turn the situation around. And for me, that was a combination of counselling with her, did hours of talking things over with her, and medication definitely was in the mix, and then also saw a psychologist ongoing for that sort of, talking therapy.
Early identification, early acknowledgement that things aren't quite right, I need to get help early, is the most important thing that we can do.
Motherhood and parenting, it's a big adjustment, it's a change. For some women, if this is their first baby, maybe it's the first time they're not going off to work. Maybe they're living somewhere where they're feeling like they don't have family or friends, they're feeling cut off. They didn't think it might be as hard to be a parent as it is. They didn't think it would take as much time. All the ads and everything we see on TV have these women that are just wonderfully, perfectly made up, and the houses are perfectly clean, and they've got these beautiful children that are clean and tidy, and that usually isn't the reality. We can feel ashamed even that Motherhood's supposed to be this happy, joyous time. Every other pregnant or parenting woman seems to be happy and joyous, and we're not. Why can't we do everything that all these other women seem to be able to do? We can feel fear and guilt sometimes. We can be a bit afraid about if we do acknowledge that perhaps there's something wrong and ask for help. What might that mean? What might happen to me? What might happen to my child? What might happen to my family? What if no one can help me? What if this doesn't get better? Or more importantly, will I be judged? Will someone think that I'm not a good mother? We use terms like that that are very judgmental, and often we're our hardest critic.
Society in general is not honest enough about motherhood and about early parenthood. I would say that a lot of particularly early parenthood happens behind closed doors. You know, you go away, you have your child, you do that in the privacy of your own home, and then you come back as if nothing's changed to the workforce. And I think that's unrealistic. But I think we could do even better if we talked more about what early parenthood is really like and how life changes when you have a baby.
Years ago, I think this sense that we still had very much that, it's almost an English tradition of stiff upper lip and you can do anything and, you know, you just get through it, you bear it. And remember, this would go back to my own mother's or my husband's, my mother-in-law's era, where definitely that wasn't spoken about. So therefore they're passing down to you that, oh, well, never mind, we all go through that, or that happens, you just get on with it. And so there was no sense of it, that it was okay to speak about it.
We can often feel as women quite embarrassed to admit that perhaps we're not coping as well as we think other women are. Women don't realise that they're not supposed to feel this way. They can think, and often if they say something to family or friends, people will come back with, well, of course you're feeling tired, of course you can't do that, you've got a new baby, it'll get better. And women think maybe it will get better tomorrow, next week, next month, and so they don't seek help. But sometimes even if they think they should seek help or want to seek help, they just don't have the knowledge or the information about where to seek help.
I certainly withdrew from everybody. Like, I didn't want to talk to anyone, and I'm a really social person, but I didn't want to speak to anyone, not on the phone, not in person. I didn't want to see people. And I think that looking back, that's probably should have been an indicator for me that there was something wrong.
A couple of times that I did ask for help because of the stigma with mental illness. I actually had a doctor tell me to get over it when I was pregnant with my son.
That particular phrase probably gets me more than any other phrase, the just get over it. If I could just get over it, I would. You wouldn't live this way if you could just get over it, would you?
I was looking forward to this being the most amazing thing that had ever happened to me, and instead I just felt absolutely traumatised and by the whole thing. And afterwards all I really wanted was someone to give me a big hug and give me a chance to debrief the whole situation over a cup of tea, and of course wanted to have a lovely long sleep, but you know, that just wasn't an option. I was thrown into the deep end of parenthood straight after that experience.
So when it comes to safe and effective treatments for anti and postnatal mental health conditions like depression and anxiety, there are a range of safe and effective treatments, and that includes, for example, psychological treatments or talking therapies, which is about giving the woman strategies to identify and manage thoughts and feelings and bring behaviours under control. So it's really taking control. Women are very conscious of what they're eating and drinking during pregnancy and don't want to take anything that might harm the baby. But certainly the research is strong now, which shows us that there are a range of specific types of antidepressants that can be safely used, not only during pregnancy, but also in the postnatal period, even if you're breastfeeding.
As a mother, you're like, I shouldn't have to be on medication to be a mother. But in my case, I do have to be on medication to be a mother, a good mother, to be the best mother that I want to be. And you kind of have to make that trade-off with, well, okay, to be the best mum I can be, am I happy to just be on medication for as long as it takes for the rest of my life if I have to be? And not see that as a failure.
We can talk and support the women to maintain their own physical health and their emotional health. So we can also link them into support services and other programs or health professionals that can help them at this time. So we can do a lot, not only about prevention and helping them to maintain their health, but helping them to recognise when perhaps they need a bit of extra help. So the education that we offer mothers is around their pregnancy, around parenting, it's around what they can eat to maintain their health, what physical activities they can do, but also we talk to them about their emotional health, what they can do to maintain that health, how to recognise if something isn't going right and where they can go to seek support for their emotional health. And we also talk to them, or the education that we give them is also around overcoming isolation.
Peachtree is a not-for-profit peer support organisation, which basically means that we offer support to other parents who are suffering from perinatal mental illness.
I heard about Peachtree from my psychiatrist. It was the early days of Peachtree, and she had heard that there were these two mums on the north side of Brisbane who were getting a peer support group together, and she thought I might be interested. It took me, I think it took me about 4 months to make the call because I was nervous about what I would find. But as soon as I did go along to their group, it became the highlight of my week. And it was about half an hour's drive from where I live, but I would go there every week without fail because the support that I received there was just so amazing. All these other ladies who knew what it was like and who I could be totally open and honest with. To hear their stories was amazing. Just to hear that there were these three other women who had been through similar sorts of feelings and struggles and come out the other side. To just be able to be completely honest and just blurt out everything I'd been through and have people not judge me but understand and really know what that was like, and to see that I wasn't the only one out there.
Peachtree started in 2011 when I met a lady called Debbie Spink in the school classroom, and we started to have some very intimate discussions about our own personal journeys about entering parenthood and how we were coping. And it soon became quite clear to us that there really wasn't enough support out there for parents in their parenting journey. And in particular, we had both had our own experiences with postnatal depression and decided that something really needed to be done in offering more support to parents out there, and that's why we decided to start Peachtree.
The reason why I'm a facilitator for Peachtree is because I would like to think that mothers who have postnatal depression have somewhere to come where they feel safe, they feel cared for, they feel nurtured, and they feel that they can say whatever they want to say in a safe environment. I've got myself, who's a facilitator, a co-facilitator, Penny, who is a social worker, who's no longer working, and she's also done baby massage, and she has an interest in postnatal depression. And I also have a gorgeous lady, Jane, who volunteers, who helps me look after the children, which enables us to set up a space for the mums where they can have a cup of tea, a piece of cake, feel safe, feel that they can talk about anything while the kids are being looked after by Jane, who is literally just right next door to us. And they're a really lovely group of women who've got to know each other well, but it's a good group of women because if anyone new comes in, which they do most weeks, we get somebody new coming most weeks, they're very warm and welcoming.
We watch our mothers come to a Peachtree meeting week after week and slowly have that sense that they're not alone, that there is a community around them that cares and understands what they're going through.
A lot of women with postnatal depression feel very isolated. They have their baby, they get diagnosed with postnatal depression if they're lucky to be diagnosed, and then they go along to a normal play group or a normal mother's group and are surrounded by very capable women. It's very intimidating and quite frightening. And to be able to come to Peachtree and to be totally open about how you're feeling and feel safe and not feel judged, and have other women who who understand what you've been through is very comforting. Peachtree is peer group support, so it's not telling people what to do, it's just talking and advising and, hey, guess what, I went and did this. Or, for example, one of my mums recently would love to go back to work, but she hasn't got the confidence. Her GP found a group of women who help women go back to work. So we now all know about that. So that's been shared with everyone, and that's on the notice board. So any new mums who come. So it's all about sharing your experience and helping each other.
Now that if we're more open and we have women helping women, I think we could achieve so much. And it's not telling the women what to do, it's listening to the woman as she talks through her story and supporting her by nursing the child, or doing something in the house, or just wandering together, you know, out to the shops or for coffee, or, you know, just listening and knowing this isn't abnormal, there are a few other women going through this too.
Probably for the first few months there was just the 5 of us that used to go, the 2 co-founders and 2 other girls and I, and I actually found it was really great because, you know, I could go in and I could say, oh, you know, like when they told me Tate wasn't going to survive, you know, here's what's happening today, and I'm picking out funeral songs and blah, 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 and the girls were, you know, they had my back, they were really supportive. And so then when I found out everything was going to be okay, you know, we all celebrated, you know, it was really lovely, and I felt like I didn't feel alone. I felt like I belonged.
That's exactly how you feel.
Yeah, it is, isn't it? Yeah.
I was so scared the first time I walked in, and then I met Jen. And that laugh. And I felt comfortable straight away. I couldn't wait to go back the next week. Even my family turned around, like my kids and my husband turned around and said how happy I was. Every Tuesday. Well, now it's every Thursday. I'd come home in a happier mood.
When someone comes to that place and that is their reaching out for help, I just thought it would be a good thing for A, someone to be there, and B, someone like me to be there, someone who's been through that, someone who doesn't judge, to just be there to say, you know what, that's okay and we've got your back.
The Peachtree group that I was going to was so life-changing for me that once I was well again, so after I had my second child, I think it was about 6 months after that, I was starting to feel like I was doing really well. I just couldn't wait to start giving back and to do the same for other parents that I'd been able to experience through Peachtree. So I was really keen to start a new group, which I did, and to be able to give back, I think, was also the final step in my own recovery.
It does feel amazing to go in there, doesn't it? And you unload all your crap.
Yeah.
And you sort of feel like, at the end, you know, and you get, you know, what the other girls have got to say and all their stories that are similar, and you think, oh, well, I'm really not the only nut on this tree. Like everybody else has all these things going on in their head as well. And, you know, yeah, it's something, I guess, when you go somewhere like that you can realise that everybody has their own stuff going on.
I think it's really important to talk about the experience. Firstly, because the perinatal mental illness is a risk factor of pregnancy. It is another thing that could happen. And I think the more that we start treating mental health the way we treat physical health, the more we're going to be able to tackle the problem in our society.
We need to acknowledge that for some people, the journey of becoming a parent is much harder than it is for others. Just like some people can decide we're going to have a family and I'm going to get pregnant, it happens. But for others, it can be a long journey, very expensive, a lot of emotion invested, going through IVF. It can be very, very difficult and put a lot of strain on relationships. Similarly, other stages of the journey towards becoming a parent can also be as varied as that from one individual to another. And I think we really need to acknowledge as a society that for some people that journey is a lot more difficult.
Although the early days are tough, it's not normal to feel like you want to hurt yourself or like you want to disappear or like you can't stop crying. And so I talk about it quite openly, even at the risk of scaring pregnant people, because I think it helps people seek help if they're having a tough time themselves.
I think that it was really a blessing. I mean, it was horrible to go through at the time, but I wouldn't be the person that I am today. I wouldn't have the strong relationships that I have with my husband and the close friendships again with the girls and guys in my network of I mean, they're really my second family.
I think motherhood is the most exciting time of a woman and a family's life, and I think it's just terribly sad that women who have postnatal depression miss out and their families and their partners have to go through it. And if I can somehow make it a little bit better and allow them to enjoy it, I think I've achieved something.